All right, welcome to ISOD Solutions. So today we are bringing you a solution that will transform the healthcare in Namibia and in Africa. So we are cloning an app that's called Teledoc Health app, which is one of the biggest applications in the health sector. But the one that we are cloning can actually help you make 12 million dollars in an annual revenue. So the problems that normally people face or we face in Africa, or almost everybody in Africa, but specifically speaking about Namibia, one of them is the lack of nearby medical facilities. And then the other one is long waiting times. People go to the hospital, but they wait for a long time to be attended to. We even heard of people that died because they were not attended to on time. And then the high cost, most of the times those specialized doctors are very costly, so it's very hard for you to find an accessible or a cheaper um, doctor. So this platform addresses all the issues above by providing remote access to doctors, reducing waiting times, and lowering costs through virtual consultations. A patient in a remote village can consult a specialist in the capital without traveling, saving time and money, meaning that you may just go there after the specialist requests for the presence of this person. And in Namibia alone, this could it could benefit 100, 1,000, a million even of people facing barriers in their healthcare. So the Teladoc Health app, or let me say the company itself, is a global leader in telemedicine. This is from, let me say, from January 2022. So that's the statistic that we are working with. It served more than 50 million users. Imagine today, by today, it's quite huge. You see, it served more in 2022, it served more than 50 million virtual visits and reported $2.4 billion in revenue. Now, this happened by connecting patients to doctors remotely, and Teladoc revolutionized access to care, especially in underserved areas. So, this same application is the same one that we are working on, that we've worked on. As you can see in our screen, we have really developed a prototype, something that you guys can see that it's already working, and you can see that you have access to the doctors, specialists, and you can even filter them. You can filter them by name or by what they do or what you're looking for, and then you can actually book an appointment with them. You can schedule an appointment. You can um, charge people for scheduling an appointment, or you can do it for free. It just depends on you, the owner of the application. If it's the government, you don't need to charge, but if it's a private sector, you have to charge for that. And then you can also find different kinds of doctors, and see your previous appointments and your current appointments. You see, as you can see, when you go inside and then you find the doctor that you are looking for, you see his profile, you see about him, where you going to school, and the hours that is available, and then you can book. And when you book, you just set up the date that you want according to the dates that he is having availability, because some of them are not available all the days or all the time. And then after booking that, you can as well decide if it's in person or if it's online. And then you tell the doctor the solution or your problem, like what is it that you want, or what are you facing, and then you book. So after you book, you have to you'll be asked to pay. So you can pay online. You don't need to really go physically. In Namibia, we have pay today. Outside Namibia, you can use Stripe. It works everywhere. in the world, or you can use Flutterwave, any kind of payment method. You can use your card to do payments, and then after you pay, you'll be having your appointment completely done inside the application, and then you can go back and see your appointment that you've done. So then you can continue looking at the doctors or at other things that you can do. Maybe you can do other appointments or go and change. You can use other languages. Imagine you don't speak, um, you speak French or another language. You can just change the language that you want, or Shuambo or whatsoever. So this app can actually integrate many languages. For now, we just used English and Spanish, which are international languages, and we had access to them. So it supports offline support and then payment integrations. You can name it. So the ISO telemedicine solution, the one that we built, is tailored for Africa's unique needs. And according to our calculation, based on the um, company that we saw previously in their statistics of 2022, we've discovered that if you serve 250 users, you can end up making an annual revenue of $12 million, like in a year. So thank you so much. You can be the next person. You can build this. Even if you're the government, you can build it for the people. But if you're a company, you can build it as a solution for people. We already have a prototype here. We already have something that we built, meaning you can add more stuffs according to your needs. So if you're interested in such kind of applications, just go to our website at www.isot.tech or reach out to us at our you can use our phone numbers and contact us directly, and we'll be able to assist you. By the way, you can also learn how to build such kinds of applications and solutions at www.isotinstitute.tech. Thank you so much and have a pleasant day. See you at the next solution.